So, very good evening, friends. Meeting again in the session of Materia Medica. Yesterday, we have discussed very short remedy, Picus religiosa, an Indian drug. And today also, we're going to learn one more Indian remedy, also having the similar types of aspects, and that is the Erigeron canadensis. Boric has explained very short about the Erigeron, but this remedy has a lot, in fact. I have treated a case a way back with the Erigeron. It was a case where there was a very long-standing metrorrhagia. There was a history nearly about 7-8 months back. There was a miscarriage happened to the lady, and thereafter she started getting the metrorrhagia along with lot of leukorrhea since 2-3 months, and which was not getting settled. She was treated by gynecologist. Then they have done the DNC, nothing worked. Then they have given the hormones. Until she used to take the hormones, it used to stop. As soon as she stops taking the hormones, it used to reappear again. And very early of her age, it was just 26, 27 of her age. And that is the um, first pregnancy with a miscarriage was there. And USG was showing that uterus is bulky, flabby, and the doctors were saying because of that you are having this problem. And this was associated with lot of leukorrhea in her case. Leukorrhea associated with lot of urinary irritation in her case. And there were two more features which were characteristic. One is the bleeding was absolutely bright red blood. Second important thing, she used to have a diarrhea and dysentery associated with this leukorrhea and associated with specifically this metrorrhagia. So metrorrhagia associated or after the miscarriage, very important, don't forget the erigeron. Second important thing, whenever leukorrhea is associated with diarrhea and dysentery which contains the blood, the bleeding tendency is characteristic of the erigeron. And along with that, she was having very severe pain in the left-sided ovaries or ovarian region. And that is another important characteristic of the erigeron. Erigeron, it looks to be a very acute remedy, but no, it is a remedy from psychotic miasm. In generally in pelvic inflammatory diseases, where the uterus is flabby, weak, not having the strength, not hold the fetus, and miscarriage happens to be because of that. And whenever there is a gonococcal infection or history of gonococcal infection, this remedy is a wonder. So it is not acute remedy, it is a remedy which is deep acting. From my point of view, it is a psychotic remedy. And that's why you get multiple features of psychotic miasm over there. The chronic dysentery, where the bleeding is again a bright red. That is one important feature one should not forget. So I have given that lady Erigeron 6 I have utilized, and I have continued it for a period of a week and asked her to meet me. After third or fourth day, the bleeding has stopped completely. Then it was repeated again for another 10 days, and patient was better, no more bleeding. And she got regular menses after a month. And thereafter, her menses recovered completely. Second important thing, her uterus, which was looking weak and flabby in earlier sonographies, it was settled completely. So this is a very important remedy in female complaints, but bleeding anywhere. In this one feature which is common to the bryonia, that is epistaxis instead of menses or vicarious menstruation or bryonia, which is also present in this specific remedy. So this is a wonderful remedy, the erigeron, that we are going to learn from the Borix medica. Open the Borix medica, erigeron. It is leptilon canadense. It is a flea vein. Hemorrhages are caused and cured by this remedy. Persistent hemorrhage from the bladder, hemorrhage from the uterus with painful micturition, profuse bright red blood. This is the characteristic. pain in left ovary and hip. So this is psychotic influence of the remedy. Chronic gonorrhea with burning micturition and continual dribbling. See, this is very important thing. Chronic gonorrhea with burning micturition and continual dribbling. Dysentery with soreness and burning in bladder. Tympanitis. So flatulence is another important feature. Female complaints are very, very important. Metrorrhagia with violent irritation of the rectum and bladder and prolapsus uteri. Bright red flow, menorrhagia, profuse leukorrhea, bloody lochia returns after least motion. Least motion aggravate, that is another feature one should not forget. Bloody lochia returns after least motion, comes in gushes. Between the periods, leukorrhea with urinary irritations. It is a very good remedy for pregnant women with weak uterus, a bloody discharge on slight exertion. Bleeding hemorrhoids, nosebleed instead of menses. It is very close to the, it is indication which is very close to the bryonia. So see, female complaints are very thoroughly mentioned by the Boric over there, but the details are not there. If you want to read the details and understand the remedy, my suggestion too is for this remedy, do read the Murphy's Lotus Mud Remedica. You will get the detailed picture of this remedy. There was one question, what was the repetition for the week, TDS or QDS? TDS for a week, that was the repetition, and no more constitutional remedy required for that patient. She has recovered. This remedy itself is a defecting remedy. It is not short acting. Modalities, worse left side. Relationship terebinthana is very similar in bleeding tendency. Dose tincture to third potency, oil of perigoran 1x internally for tympanitis. An enema of 1 gram of the oil with the yolk of an egg and pint of milk will reduce the most enormous tympanitis. But these things I don't know regarding it, so I have not utilized. But there is one experience. This Dr. Burt has proved this remedy, and one important thing, Dr. Moore, who has utilized this remedy for the placenta previa, and he has used it in 1x potency in repeated doses, and that placenta previa bleeding has stopped completely with that. So it is a wonderful remedy, short remedy, but must always understand, and it is not short acting, it is a deep acting psychotic remedy, one should not forget. So that's all for today. We'll meet tomorrow, most probably, with another remedy. Thank you, and most probably I will try my level best to maintain this flow. And good night.
Thank you, sir. Good
Thank you,
night.
sir. Have a good night.